Hello everyone, we are Group 9 in Vision 420 Nutrition Aspects of Disease doing ovarian cancer.
So, why should we care about ovarian cancer? This is because there are so many people around the world get diagnosed with ovarian cancer. So, there is a chance that one of our family members or friends is going to be one of them. This is why we should have knowledge about this disease and take preventive steps.
Now we are going to discuss some background information regarding ovarian cancer. In terms of the occurrence, nearly 250,000 women globally are diagnosed each year with ovarian cancer. It is estimated that 140,000 women die each year from ovarian cancer, which is why it's the 7th most common cancer worldwide. Some common symptoms associated with ovarian cancer include increased abdominal size, difficulty eating, frequent urination, and abdominal or pelvic pain. Most patients are treated with surgery if the ovarian cancer hasn't spread out to the rest of the body, but some other commonly employed treatment methods include hormone therapy, chemotherapy, and radiation therapy. Ultimately, early treatment is critical to the increased survival of women diagnosed with ovarian cancer.
The first nutrient that we researched was lactose/dairy and whether there is a solid evidence in relation to ovarian cancer. Is the consumption of dairy/lactose associated with a higher chance of developing cancer? This is the main question we wanted to target. One of the studies that we found suggested that a higher consumption of dairy foods/lactose could potentially lead to the development of ovarian cancer. This study was largely focused on a large-scale case control study in Australia, including about 800 historically confirmed cases, 800 community controls, and 300 controls recruited. The study categorizes the relationship between the consumption of dairy foods and increased galactose exposure in regards to development of ovarian cancer. The controls for the study were selected at random. All of the women were interviewed in a standardized face-to-face setting, and 90 to 95% provided dietary data via a self-completed food frequency questionnaire. The results indicated that there is a significantly elevated risk of ovarian cancer with the consumption of whole milk and an elevated risk with an increased consumption of full-fat yogurt and cheese. On the contrary, there was no direct association with the consumption of low-fat yogurt or cottage cheese and proved an overall decreased risk with the consumption of skim milk. The results also implicate that ovarian cancer may be associated with the fat content of dairy foods as opposed to lactose or galactose content of such foods.
Another study that we looked at was a prospective study in the Netherlands that was conducted to further test the hypothesis that lactose consumption can potentially increase the chances of developing ovarian cancer. All females involved in this study were required to complete a 150-question food frequency questionnaire to examine food and beverage consumption behaviors. The vital stats of each female were measured as well. The study employed a strict screening criteria for the selection of female participants, and a total of 2,406 females were involved in this particular study. The cohort study followed up with randomly assigned subcohort female members over the course of 11.3 years, and there's a total of 282 confirmed cases of ovarian cancer during this time period. The findings of this study were not statistically significant to associate a link between increased dairy consumption and the development of ovarian cancer. Women in the highest category of total milk, total yogurt, or total cheese consumption were not at greater risk of ovarian cancer compared to women in the lowest consumption category. The epidemiological results in this well-conducted cohort study show that an increased dairy consumption does not cause ovarian cancer. However, there are still conflicting results that are discussed in the article that support and disprove these findings.
Overall, the information from these studies is not strong enough to correlate increased dairy consumption with the causation of ovarian cancer. The combined grade for these research articles would that be of a C. Although they are supported by epidemiology, which can be categorized as a B, there is conflicting evidence with other studies that are mentioned. Furthermore, it is very difficult to evaluate overall dairy consumption from dietary recalls and food logs and apply such information over the entire length of the studies. Food questionnaires require knowledge of portion sizes as well, which could be a potential confounding factor that misrepresents dairy consumption. This ultimately devalues the validity of the nutritional relationship between high dairy consumption and ovarian cancer development and illustrates the necessary for further research.
After we have reviewed on the relationship between lactose consumption and the risk of ovarian cancer, now let's switch gear and focus on the second nutrient, folate. Let's see, is the consumption of folate associated with lower chance of developing ovarian cancer? This cohort study was conducted over 22 years. In the beginning, there were over 120,000 of nurses aged from 30 to 55 participate in this study. This cohort study was a questionnaire based where they would send out a new questionnaire to participants every 2 years for update information. As a result, only over 80,000 with a majority population of Caucasian women participate in this study. After 22 years, there is no strong relationship between increase of folate consumption will lower or increase the risk of epithelial ovarian cancer. There is another study we found, which is the Swedish mammography cohort. It was conducted from 1987 to 1990, including a cohort of 61,000 women aged from 38 to 76. The qualified participants were invited to this study by mail questionnaire based on the list of participants in the mammogram program. The questionnaire consists of 6 pages of questions that involve participants' diet, age of having their first baby, weight, height, education level, and the family history of breast cancer.
And the dietary assessment involved a food frequency questionnaire that contained 67 foods, including alcoholic beverages. The study finally reached the conclusion that there was some association with high folate intake and a reduction in the risk of having ovarian cancer. A correlation was also found for women who consumed alcohol with high dietary folate intake and a reduction in the risk of ovarian cancer. Because there is no evidence suggesting that there is an association between folate intake and the development of ovarian cancer, so we give B as an overall evidence grade for these papers.
There is still conflicting evidence regarding the hypothesis that lactose in dairy consumption may increase the likelihood of developing ovarian cancer. In conclusion, no nutrient recommendations can be made in relation to the nutritional prevention of ovarian cancer. More research studies need to be conducted to further investigate this hypothesis. Ultimately, with more research and accurate data, a nutritional recommendation can potentially be made in the future.
The same applies for folate. More research studies need to be conducted to further investigate the hypothesis that increased folate consumption can prevent ovarian cancer. Ultimately, the nutritional recommendations for ovarian cancer lacked validity and strong research data.